Now, Kentuckiana's only radio program where together we discuss proactive aging in the right place with a choice. This is Aging in Kentuckiana with Chris Prentice and Kim Gravenkemper.
Good morning, everyone, and welcome to Aging in Kentuckiana, where each Sunday from 10 in the morning to 11, we explore the many opportunities available to us to age in the right place with a choice. We have so many wonderful resources for our aging community, and today is no exception. And we will get to that in a little bit, but before we do that, as always, I want to give a special thanks to Comfort Care Senior Services and Comfort Care Louisville East, our corporate sponsor. The caregivers of Comfort Care, thank you for allowing us to love Mom and Dad while we allow them to live in their place of choice, in retaining their dignity and independence. So, with all that said, I want to bring in my wonderful co-host, Kim Gravenkemper. Kim, good morning.
Good morning, Chris. How are you?
Doing well. We're into now almost a month or 4 programs, and each week we have had a very important guest that serves a purpose in allowing Mom and Dad to age in the right place.
That's right. And today is no exception. We've got 2 lovely ladies that are here from Extended Care. We've got Extended Care house calls, and we've got 2 partners. We've got Kim Cashion and Pam Alvey. Welcome, Pam.
Thank you. Good morning.
And welcome, Kim.
Thank you, and good morning.
You all provide such a valuable service to the senior community. We will have a lot to talk about today, I am sure of it. But in the simplest of terms, let's talk about what extended care represents.
It's an open-ended question. We do a lot, but in simple terms, we are doctors and nurse practitioners that provide primary medical care in the house. We take the office to their home, such as you mentioned before about making the independence, keeping them independent at home.
That is a wonderful service. So basically what you're saying is it's like in the olden days where the doctor would make the house calls and they would visit and show up with their medical bags, but I'm sure you provide so many more services than they do.
Yes, we do. We could go on for hours, but we even bring the hospital, if you will, to the home. There's so many options that we can do and resources that we work with to keep the patient home.
Well, it's kind of interesting, Kim and Pam, in the fact that when I was a little guy growing up in Bardstown, the physicians in that small town then would go out and make the house calls, and Dr. Spalding would come and visit, and he'd have his black bag with all of his tools of the trade, so to speak. Just, I guess, simply because I had a cold or I was very sick. I was a sickly kid. Anyway, and instead of taking the sickness into the doctor's office, Dr. Spalding would come and visit. But I was a little guy. But in this situation, which is quite common with Mom and Dad, it's not easy getting them in the car and taking them. So, in essence, you're the doctor at their office in the home.
Yes. And they're also sicker. You talked about you being a sickly kid. These adults they're older with multiple conditions, multiple comorbidities, and they are sicker and they require more care. And as you mentioned, the doctor with the bag coming to your house, we can also bring x-rays and ultrasounds and medicine. There's so many things that we can do to help keep a patient at home, so they don't have to take them to immediate care or emergency room.
So it's really all about, well, a convenience factor, because again, packing Mom and Dad up, Kim, to go in the doctor's office, it's not easy.
No, it's not, and we do see folks based on homebound criteria is deemed by Medicare guidelines. We're not a concierge practice, but we see a wide variety of patients, not only in the home, but we also cover assisted living, personal care, and nursing homes as well. So we do multiple levels of care. We actually can follow the patient from home to facility to hospital through hospitalists that we partner with, and then we can even follow them home to end of life.
But you use the term concierge. What do you mean? What did you mean by that?
And that is private pay.
Okay.
We bill the insurances. It's some companies out there do private pay.
Right.
But we bill the insurance. There's no fee to or bill to the
patient.
Correct.
Well, you're in essence the doctor office on wheels.
Yes.
Correct.
And with that comes, are there unique challenges that you face as a result of doing that? And is there an office that if mom and dad wanted to come visit, they could to receive your services?
It is complicated to get to the patients, but that's why we're here, and that's why we use all the resources that we do. I can start to talk about some of them. We use lab companies. We use home health, medical and non-medical companies. We use diagnostic. We have pharmacies that deliver. We can do IVs at home. We can deliver non-invasive ventilation machines at home. There is so much that we can do to keep the patient at home. Is it more complicated? Yes. But it is what we do, and it's part of our day every day to do. And do we have an office that they can come to? No.
Let me ask a question. Would you agree that you can be either an extension or, per se, a replacement of one's primary care physician or traditional care team?
Yes, we can be. The extension is if it's just temporary. Say mom and dad has had a hip replacement or a knee or a stroke, and they just need a little bit of homebound criteria. Like you said, It's difficult to get them out for the first 4 to 6 weeks till they get fully healed. Then yes, we can stay their primary for that 4 to 6 weeks, and then we will discharge them back to their primary care. Or if they don't get better and still can't get out of the house, then we can stay the primary care.
It is such a safety issue as well. I mean, it's not only a convenience, but it's a safety issue. I see it from my standpoint. It's such a blessing to know that you all have this service, because I think about it from, like I said, from my side of it, where I have a father that's with me and may need. When I heard what you all do, and I heard that you will go to the home and do an X-ray if he hurt his knee. He just hurt his knee. So, just to know that you all do that and you provide that service so that I don't have to take him out if that needed to happen, and, if he couldn't get around, that's just such a valuable resource.
Well, it's kind of funny to all of you that one of the biggest issues that I have in going to a doctor's office is, I'm in there. I'm in the waiting room for a lot longer than I'm in to see the doctor, and so many times there's people in there that are really sick, and I may not have been as sick as I was when I went in there than when I leave, and so in essence, you can confine if we're talking about the flu. Of course, the flu right now is in its heightened state. You're keeping it kind of quarantined, if you will, by going to the individual homes, right?
Absolutely. We tell people if you go to the emergency room, you're going to get sicker. We really don't want our patients in the hospital. Like I mentioned, we can do IV antibiotics at home. If mom or dad needs some fluids because they're a little bit dehydrated from the flu, we can do IV fluids. If your dad was our patient, we could order that X-ray, and you wouldn't have to take him to an emergency room or an immediate care center. We could take over that care.
How did you come up with this idea? How did it start?
Well, it's been here. We're not the first ones to do it. But I will first start off by saying that we get paid to do God's work. It is a blessing to both of us. But we originally started 10 years ago in the nursing homes, and as the need arises, which is keeping patients out of the hospital, keeping them out of the emergency room, we were asked to start going into assisted living, independent living, then the homes and daycares. So it's God opened the doors.
He sure did.
Absolutely. I feel like we're just scratching the surface with Pam Alvey and Kim Cashion with Extended Care House Calls. And when we come back, we'll dive more into the details as to how their team makes medical care so much easier for our aging community and Kentuckiana families. So with that, you are listening to Aging in Kentuckiana on 970 AM, The Answer.
I wouldn't let aging stop me from being me.
Oh yeah, still got those moves in me.
I will be fabulous. I will accessorize. I'll smack old age right in the kisser.
With Comfort Care at your side, you can stay at home and defy expectations. For a free in-home consultation, call 502-254-0850. That's 502-254-0850 and live your best life possible with Comfort Care.
Now, back to Aging in Kentuckiana on 970 AM. The Answer.
Welcome back, everyone. You're listening to Aging in Kentuckiana on 970 AM, The Answer. And Kim, what a wonderful thing that the nickname of this station is The Answer, because in essence, that's really what we're trying to do each Sunday from 10 to 11 is to get the answer, which was kind of the reason why I kind of got into loving our aging population, because in taking care of Dad, I had a lot of questions and really didn't know where to go get the answers. And so when we have someone like Pamela Alvey and Kim Cashion with Extended Care House Calls, it's a great opportunity for you and I to learn, as well as our listening audience. So I know that you've got some more questions that you really want to elaborate on, or have Pam and Kim elaborate on. So take it away, Kim.
Absolutely. I think it's even more selfish reasons, just finding out the answers for myself and also for everyone else. So if I were looking for someone or services for, like I had indicated, broken leg, my father can't get out, how would we go about contacting you all, and what is the best form of communication with you all in a normal day?
How do we find out about you?
Multiple ways. Website. We have a phone. We have a telephone number that's advertised. We put out brochures. We have a fax number. We even have a referrals email. We get referrals from all sources, even from Facebook. We've had posts on Facebook. We do advertise, even Instagram. Word of mouth gets out there, and you can reach us by any of those methods.
24/7, 7 days a week. How does that usually work?
We're a Monday through Friday office, so we do have staff within Monday through Friday that can answer from 8 to 5, but we do have people that overlap into the later hours in the evening, and a lot of times you'll find owners responding to those emails, and then we have a billing department that can verify eligibility within 45 minutes. And we typically, within an hour, can tell you when we're going to come out and see you.
You can reach us many ways, like Kim said. Actually, over the weekend, there was a son who was emailing us over the weekend about what to do with his dad, that his mom had a shoulder replacement, and he did not want to take her back to ortho to get the x-ray because he didn't want to take her out of the house. So we emailed all weekend, and he contacted me on Monday and was just very, very appreciative. So I have patients Facebook message me. Families usually is who that is, that'll message us on Facebook. So you can call, email, text. You can fill out a form online. We've even had families come to the office, haven't we?
We have.
So multiple ways.
It's really interesting that, okay, you got a call from this gentleman.
It was an email, actually.
It was an email, but, mom or dad in this case, he had a general physician, but somehow he had the wherewithal to actually find you. So there was probably something somewhere where he heard about your services, and in this case, it really came to fruition to help them in this situation, right?
Yes, I think he was on a Google search, and of course he couldn't get a hold of the doctor over the weekend. But like Kim said, we are Monday through Friday, 8 to 5, but a physician or a nurse practitioner is on call 24/7. And we do utilize our resources. If we can't get out there, we work with many home health agencies to help us keep the patients at home.
And that's a wonderful thing, too. I think what we had discussed earlier is the fact that you all work really closely with hospitals. You not only taking care of the clients and the patients at home, but that you also extend into hospitals, into communities and things like that. And you had mentioned something about the different types of equipment that you take in. And so how does having those things and providing those services help alleviate them having to go to the hospitals? Tell us kind of that step by step.
Yeah, actually, I'll give you an example that happened a couple days ago. I was asked to look at this lady's chart because she kept going in and out of the hospital. And I went back and looked for about the last year. She's in the hospital every 2 to 3 weeks for 3 to 5 days for end-stage COPD, obesity, obstructive sleep apnea, and end-stage renal disease on hemodialysis. I looked at her medicines, looked at everything that was going on, and she requires the ventilator when she's in the hospital. They do non-invasive ventilation in the hospital. I can get that provided at home. So I work with a respiratory company. A respiratory company is the best way to describe it. And send the order in, and they deliver the machine, and they also have a respiratory therapist who follows the patients. The medicines are delivered to their home. They educate, and they help us follow the patient. They will see the patient monthly, in addition to us seeing them, in addition to medical and non-medical home health, labs, x-rays, and treatment. So far, I know it's only been a few days because everyone was emailing back and forth in the office. They said, I bet you she'll be in the hospital tonight. She is still not in the hospital. I know it's only been a few days, but it's progress.
That is incredible. I mean, and the follow-up then. So let's touch back. Okay, so medications, you all can help assist with those. You can also help with the equipment. Who does the follow-up? You all will do the follow-ups.
Yes. The doctors and nurse practitioners, yes.
That is wonderful.
And the office staff, we even have a policy that the office staff will call back. We have them on a list that says, okay, Miss Smith was treated for CHF, and we just started a new non-invasive ventilator. We will call and check on her daily until we feel she's stable, plus we will see her frequently.
How do the hospitals feel about that? How do they feel about you all helping with their patients? I know that they get overloaded and things as well, so I am sure you are such an asset to them as well.
They love it.
Yeah.
They love it because we actually try not to use the emergency room. If we can't keep a patient at home, we will try to do a direct admit. And that keeps them out of the emergency room. And like you said, they're overloaded. We all are.
Right.
And not just the patients or the families, it's also the medical profession. It's overloaded, and we need to all help each other and work together.
I feel like you all are a liaison, like just a wonderful buffer.
Oh, exactly. Well, I think my general practitioner, for example, he, over the last couple years, stopped making visits into the hospitals. And it's not, and not every doctor is welcome into every hospital. Is that correct?
That's correct. Most hospitals now have their own hospitalist groups that round. We do partner, and we actually even have our own that we work with very closely in all of the area hospitals in the greater Louisville and Lexington area that we can call, get a direct admit, or we work very closely with everyone, not just hospitalists, physician practices, other specialists. We communicate, and I think we pride ourselves on that's another way we keep patients in the home is that we are not afraid to contact anyone to gain any information we can on the patient that will help take care of the patient.
I have an example, too. This was yesterday. One of our patients was having a procedure, and the procedure was he was having a scope to look at his esophagus, and they found multiple ulcers. And he said, I cannot send this patient back home. I want him to be admitted to the hospital. So we called the local hospital and got the patient a direct admit and bypassed the ER and kept him safe. And he went to the hospital. He was discharged. I think it's today, later today. Yeah, he's getting discharged. So no ER. Patient didn't go home and have a stomach bleed or anything like that. Kept him treated and back home.
You know, I really don't know of any individual that would not prefer to be at home as opposed to being in the hospital. And when the time that we're spending with you guys here today, I just can't get enough of the feeling of how wonderful and what a valued service it is that you provide that allows mom or dad to stay at home with their dignity and with their independence. And when we're going to take a short break, and when we're going to come back, we're going to talk a little bit more about these other communities that you may be visiting. You're listening to Aging in Kentuckiana here on 970 AM The Answer.
I wouldn't let aging stop me from being me.
Oh yeah, still got those moves in me.
I will be fabulous.
I will accessorize. I'll smack old age right in the kisser.
With Comfort Care at your side, you can stay at home and defy expectations. For a free in-home consultation, call 502-254-0850. That's 502-254-0850 and live your best life possible with Comfort Care.
You're listening to Aging in Kentuckiana, where together we explore options of aging in the right place.
Welcome back, everyone, to Aging in Kentuckiana. And this morning we have the privilege to be speaking with Pam Alvey and Kim Cashion with Extended Care House Calls. And ladies, I know it takes a village. And with you all, it's certainly a team effort to make this possible and for your success, your huge success. And so with that said, let's talk about your team a little bit and your other partner.
I'm so glad you brought that up. There's 3 partners. It's myself and Kim and Dr. Suresh Nair. And then we have many other staff members that we are very blessed to have with us. Kim and I will tell you that we have the best nurse practitioners, medical assistants, doctors, physician assistant, and nurses and billing department. We all love what we do. Again, we are paid to do God's work, and our staff is the most amazing staff we could ever ask for. Seeing the patients, working late, taking the phone calls. It means so much to them as well as us. Everyone owns this company. Everyone is a partner, and we have the best clinicians in the office and out in the field, and even in the back office that's doing our medical records and insurance verification and things like that. Our motto is we're patient-centered and we're responsive. And to tell you how responsive we are, you can't even leave a voicemail because you will get a person. So they are very dedicated, and we are very blessed to have them. And we want to thank all of our staff for being with us, and we're so happy to have them.
We had the pleasure of being in your office yesterday and seeing how your team is working and how everybody, you can tell they just get it. And they are just so happy to answer and solve problems. And one instance where I saw a situation that was occurring and how serious they took that situation, one particular individual that I saw, and they were so serious about that. And after it was almost reconciled, the look of relief on her face that it was solved and they were able to help. So I saw that. And that made a difference, too, just knowing that you have caring individuals who are dealing with the people that are going through a crisis situation. That meant a lot to me to see that, and I'm sure it would for everyone else, knowing that they can call and they'll get a caring individual that will help them through their situation.
Our office actually acts like we've kind of coined the term a mobile ER. Is really what we're like. We probably get 200 to 300 phone calls a day, and I would say 70% of those phone calls are urgent. A fall, cough, congestion, bladder infection, rash. So what do? We utilize our resources, we take care, and we solve the problem. Like you brought up the individual yesterday, that was the gentleman that we direct admitted to the hospital. So yes, and that's what it's all about. Teamwork, a village, a family. It's amazing.
From the family's vantage point, it's really easy to love you guys. It's easy to see the value. But from the hospital side of things, you've got to be a real godsend to them, because in the example that you brought up earlier about the young lady that kept bouncing in and out of the hospital every 2 weeks, that's a transitions of care nightmare for hospitals. They've got to be looking at you as, you make the opportunity for them to be penalized less, simply because you're so reactionary.
Very much so. We actually had, this was when we first started, it was a hospital discharge planner, and they gave us a very complicated patient. And Kim's nodding her head as she remembers who it is now.
Mm-hmm.
And
I do.
They called us up a couple months after we picked up the patient, and they said, we want you to know that this gentleman was in the emergency room every week or more. And we gave him to you, and we tracked him just to see how the results or outcome would be. And I guess it was, 3 or 4 months? And they said he had not been back to the hospital since we had picked him up. And then that's when they really started, like you said, loving us, and they make sure patient doesn't have a primary care or multiple comorbidities or returning to the emergency room. They call us, we talk about it, and we get a plan in place and get the patient taken care of.
I think that, again, Dad's your patient at home, and something happens, and Dad does end up in the hospital. It's almost, I guess you can note without any hesitation at all. I mean, if need be, you can coordinate the care plan or even visit the hospital, correct?
I'm glad you brought that up. We actually have a patient care navigator, one of our many medical assistants we've assigned that role to. And that what they do is they track our patients when they're in the hospital. We work closely with the case managers. We know what's happening. If they need to go to a higher level of care, we'll work with them to get them back to where they need to be.
Okay. Excellent. We're going to expand upon that a little bit when we come back. And Kim, we're up against a break. So what we'll do is let's expand upon that a little bit more. Again, we're punching old age in the face with Pam Alvey and Kim Cashion of Extended Care House Calls, and you're listening to Aging in Kentuckiana on 970 AM, The Answer.
I wouldn't let aging stop me from being me.
Oh yeah, still got those moves in me.
I will be fabulous.
I will accessorize. I'll smack old age right in the kisser.
With Comfort Care at your side, you can stay at home and defy expectations. For a free in-home consultation, call 502-254-0850. That's 502-254-0850 and live your best life possible with Comfort Care.
I wouldn't let aging stop me from being me.
Oh yeah, still got those moves in me.
I will be fabulous.
I will accessorize. I'll smack old age right in the kisser.
With Comfort Care at your side, you can stay at home and defy expectations. For a free in-home consultation, call 502-254-0850. That's 502-254-0850 and live your best life possible with Comfort Care.
This is Aging in Kentuckiana on 970 AM. The Answer.
Well, welcome back. We thank you all for listening to Aging in Kentuckiana this morning. And we're visiting with Pam Alvey and Kim Cashion with Extended Care House Calls. Before the break, we started talking a little bit about how you all assist the hospitals or the patients in the hospitals, and to what extent you all provide any type of service or care or support to the patients who are in the hospitals. Tell me a little bit more about that.
That's a good question. And first, I do want to clarify, we do not see patients within the hospital system. We do work with the hospitalists when they are in. So we have created a role to assist our patient care navigator from the office setting. We have a nurse that will be a liaison going into the hospitals, working with the case managers, tracking our patients when they're in the hospital. We work with a host of people in order to get them back to the level of care they came from or that they choose to be in. So there are many times many of these patients cannot function any longer in the home setting, and they need to go to a personal care home or an assisted living facility, or maybe they now need nursing home care. We refer out to many different nursing homes. We have insurance navigators, people that help with that transition, as well as our own team. So we have found that communication piece needed to be added to what we do so that we don't lose track of what's happening to our patients, because many times, as you know, when you go to the hospital, it's almost like you've fallen off of a cliff and your regular doctor doesn't go to the hospital anymore. So who can help you? Who is your resource? Well, we are. But we are a village, if you will, and we do reach out and extend and communicate with a group of people.
That's an incredible thing, and I think the extension, as we had indicated earlier, the extension that you all provide going to these communities then after they go from the hospital to a community or a rehab center or back home. And you all provide those follow-up visits, that follow-up communication, which is so important as well, because that does kind of fall through the cracks, I think, sometimes.
Absolutely, and many times folks that are in the hospital over the years, from what I've seen in the past, as well as my partner sitting with me here in business, many people don't know that they will refer you to a rehab facility that maybe you're not familiar with. So we have been in just about every type of facility. We can help recommend what would be best for the patient and what they're looking for. So we have an array of different levels of care that we can help get that patient to where they want to be, and that we can give them that information and that peace of mind that, yes, we can follow them there and help take care of them.
You have earned that reputation, that caring, consistent reputation of just follow through. That is a huge thing.
Yes, and I wanted to add to what you said, Kim. Kim and I have been going to hospitals and meeting with the chief medical officer and the lead physicians in the emergency room and the hospitalist, and it was so amazing that they had the same concerns we did. When you said the cliff analogy, that made me think of it. One of the emergency room or hospitalist physician said to us in the meeting, he said, "I'm scared when I send my patients home because I don't know what's going to happen to them." And then a week or two, they're back. He said, "So if I can reach out and talk to you," he said, "this is amazing." So it's all the communication and all the resources and all of us to stop working in silos, I guess, if you will, little pillars. Let's all get together and talk and take care of our patients and use all the resources that we can to make that happen.
Let's take that a little bit further. So the patient leaves the hospital and you feel like there is possibly some sort of supplemental care that needs to occur for that person to be home safely and to be able to live in their own home or in their community or wherever they are. What do you all do as far as a non-medical? Do you offer services for that, or do you recommend services for that?
Well, we recommend comfort care would be one of the first choices, but non-medical hired help is always an option for most families. And then there are those that it's not, but it's certainly an added piece. I can't tell you how many times we've had non-medical help that are just even providing respite and just providing that supervision that they need because it's not safe. They've been ill. They've been in the hospital. We also work with home health care companies that can provide skilled nursing care and also physical and occupational therapy to help them get back onto their feet. There's even the social services piece out of home health care that can help with insurance. It can help with finances, insurance issues. Maybe they do need to go to a different level of care. In addition to our company reaching out, and we even have insurance navigators who I can't recommend enough that help also with helping you not to get a large bill.
That's what I was going to just dig into a little bit, is the insurance side of it, because what a benefit for you all to be able to submit those claims for these clients yourselves. So you all accept insurance insurance.
Yes, we accept most insurances.
Okay, and you've got a department that does that.
Yes,
so that makes life so much easier.
And we have patients that have issues such as we had a patient call the office and said she could not afford her blood thinner or her blood pressure medicine. Well, that's not acceptable. We have to do something. So we called our insurance navigator that we refer to, and they looked at her insurance, and her co-pays that for the month were $500. They got her co-pays down to $2.65 a prescription. Instead of $50 to $100. So with that, we were able to keep her out of the hospital. I can project what I think would have happened, a heart attack or a stroke. Who knows what would have happened to her? She would have ended up back in the hospital. But with us utilizing our resources, we were able to keep her home, and she was able to afford her medicines. So again, it's all about networking and the non-medical side of it, comfort care. We have your staff call us and say, Mrs. Smith's not acting right. It's just something's funny about her. Can somebody come see her? Well, guess what we do? That's when we bring in the home health, the medical side of it. We get a nurse to get out there, do the lab work. We get the x-ray company to do a diagnostic procedure if needed be. We get our provider out there and we start treatment of whatever we think is going on. We don't want to delay it because we know that's how they'll end up back in the hospital.
Well, Kim, I don't know about you, but when this show's over, I'm giving these guys a call because I want to get those prescription costs managed a little bit more. You know, we find in a lot of times with our seniors, obviously, falls are a big risk and a big problem, and we do our best to manage it, and I know you guys do as well. I want to touch on real quick because we're almost up against the break. So if mom or dad falls in the house or has an acute problem, I can give you a call, right?
Absolutely.
Yes, and we will order the x-ray, and we will get the home health team out there, and we'll get them in a falls program.
Okay, and we'll touch on that a little bit more when we come back. Again, you're listening to Aging in Kentuckiana on 970 AM The Answer.
I wouldn't let aging stop me from being me.
Oh yeah, still got those moves in me.
I will be fabulous.
I will accessorize. I'll smack old age right in the kisser.
With Comfort Care at your side, you can stay at home and defy expectations. For a free in-home consultation, call 502-254-0850. That's 502-254-0850 and live your best life possible with Comfort Care.
I wouldn't let aging stop me from being me.
Oh yeah, still got those moves in me.
I will be fabulous.
I will accessorize. I'll smack old age right in the kisser.
With Comfort Care at your side, you can stay at home and defy expectations. For a free in-home consultation, call 502-254-0850. That's 502-254-0850 and live your best life possible with Comfort Care.
You're listening to Aging in Kentuckiana, where together we explore options of aging in the right place.
Welcome back, everyone, to Aging in Kentuckiana on 970 AM The Answer. We're with Kim Cashion and Pam Alvey with Extended Care House Calls. And in closing, guys, I'd like for you to share with us how families can reach out and start services with you guys.
I'll be happy to answer that. We have a website. Our website address is www.echp2u.com, or you can just Google Extended Care House Calls. That's one way. There is an email that they can email us. They can call us at 502-356-4377, and they'll get someone on the phone. We don't let anyone leave a voicemail. So there are multiple ways. We even have brochures and word of mouth, and our phone number is plastered everywhere, even on the website. So I think those are the two easiest ways to find us. And then as far as locations, we do service the greater Louisville and the greater Lexington area and surrounding counties.
And that's a moving target as well. You're ever growing.
We are ever growing, yes. So just call us, ask us if we cover your area, ask us if we can take your patient or your loved one, your family member. We'll tell you within 1 hour whether we can. We verify the eligibility with our billing team, and 9 times out of 10, we can take care of your loved one, and we'd love to.
Well, that's great. And it's so easy to get a hold of you all for the incredible services that you all provide. So thank you both for being with us today. It's been an absolute pleasure speaking with you all, and what a service you provide to our community. So thank you both for being here.
Thank you for having us.
Yes, thank you for having us.
Kim, I think at this time we want to share with our listening audience, in case they missed the broadcast on live or on Sunday mornings at 10, how do they listen to a broadcast?
Well, sure, Chris. One thing that might be kind of neat is we do have our website. We would like to give shout-outs to people that are listening and to let us know that you're listening, and we would be happy to take any questions, or if you know of someone that you feel like would benefit our community in speaking with us on here, or just to let us know that you're listening, you can go to our website, which is www.echp2u.com. Aging in Kentuckiana, Kentuckiana is spelled out, Kentuckiana.com. And we will have archived shows that are on. In fact, Pam and Kim, your show will be on the website. So if there's any listeners that want to listen and gather information, didn't miss part of the show, and it also will have our future guests on, who we'll be happy to have George Kraft with Senior Benefits Alliance, and Tara Wasson with Emeticis, and we'll have Kentucky Elder Law on in the near future. So with that said, if you want to visit our website, it's again www.aginginkentuckiana.com.
And the other thing that I want to say in closing, if you know of a family that would receive just a tremendous benefit from working with extended care house calls, again, you can visit their website that Kim shared with you, but also you can point them in the direction of the show. Maybe they would simply benefit from listening to the show. Direct them to the Aging in Kentuckiana website as well.
And it would have their website as well connected.
Absolutely.
So if they did not hear that or catch that, they can go onto our website and hit visit website, and it'll take it right there.
Right, and they'll also can listen to previous broadcasts that again had a benefit to our aging community. So
correct.
We'll be back next Sunday, same time, same place, same channel, as they used to say on Batman, 10 o'clock on 970 AM, The Answer. Thank you for listening, and we'll see you next week. Thank you.
The preceding program has been a paid commercial advertisement.